we are in an ENT class. We'll have a pre-final mastery class where today with our first class, we will study about ear anatomy and vestibular system. Myself, I'm Dr. Nawal Mohammed and we are here on this platform called Auricle, where we'll provide students for the university exams and for the next exam upcoming. All right, so today's class will be anatomy of ear and physiology of vestibular and auditory system. So we'll have a long essay. We'll have anatomy of middle ear cleft with a neat label diagram, and we'll have short essays mentioned on your screen. Physiology of equilibrium, vestibular system, tympanic membrane, intratympanic muscles, anatomy of membranes, escutcheon tube, and McEwen's triangle. Okay. So we'll have a recorded class, live class, practical sessions, exam modules, and hard copy book sets available on our platform. We have an exam express module. We have one-on-one doubts clearing sessions. So anyone here on live class can clear the doubts anytime when they have any clarification to be done. We'll have practical sessions also before your exams to prepare you for your practical exam. We have 4 plans here: foundation plan, advanced learning plan, complete learning plan, and ultimate plan. The last 3 plans have all the modules available, all the benefits available for you. But the foundation plan, you will not be able to use the benefit of hard copies and doubt clearing sessions. So we'll start our class today. So the first topic is anatomy of the middle ear cleft, and the examiner will ask you to draw a neat label diagram as well. So middle ear together with an osteition tube. So we have an ear, and the entry towards the ear is called an osteition tube. So osteition tube and middle ear, along with adductus antrum and mastoid antrum cells, is called middle ear cleft. All right. It is lined by mucous membrane and filled with air. Remember this. It is lined by mucous membrane and filled with air. Coming to the elaborated part, the middle ear extends much beyond the limits of tympanic membrane. So you have an external ear, then you have a middle ear, escutcheon tube, and then you have middle ear. So after the tympanic membrane, you have middle ear. Okay. So it has a lateral border that is towards the escutcheon tube, and it has a medial border. So now the lateral part is divided into 3 tympanums. Okay. So we have mesotympanum that comes up like this. If we cut the head like this, so we have mesotympanum up. Then we have epitympanum in between. Sorry, we have epitympanum up, mesotympanum, and we have hypotympanum. Epi, meso, hypo. All right. So epitympanum, also known as attic. So it is actually above the pars tensa. All right. But it is medial to sharpenal membrane. Here we have a diagram, if you can see. This is how we'll have. So the upper part is epitympanum, the middle part is mesotympanum, and the lower part will be hypotympanum. Coming back. All right. So now the epitympanum is the middle part, and mesotympanum is opposite to pars tensa. Epitympanum is above the pars tensa, and hypotympanum is below the level of pars tensa. So one is above the level of pars tensa, that is mesotympanum. One is at the level of pars tensa, that is epitympanum, and one is below the level of pars tensa, that is hypotympanum. Then we have parts of middle ear. So in exam, it is very important that you mention it in this form: the roof, the floor, 2, up down, roof and floor. And then we have anterior wall, and we have a posterior wall, and we have a medial wall. Okay, so it's like a box. So this will be your medial part, anterior part, posterior part, roof and floor. So the roof is actually a thin plate of bone, and it is known as tegmental panel. You have to just remember that the roof of the middle ear is known as tegmental panel. Okay, it extends posteriorly to form the roof of adductus antrum. So it extends towards the posterior part as well. So the roof is a thin plate known as tegmental panel. Now the middle ear has a floor as well. So floor is a thin plate of bone. All right. So floor separates. So here down you have jugular bulge. Okay. So the floor of the middle ear separates your jugular bulge from the middle ear. Roof, floor. That's it. Now we have an anterior wall. So let's assume this is your left ear. So your anterior wall will be on this side, on the other side. So anterior wall is a thin plate of bone that separates the cavity from internal carotid artery. So there is an internal carotid artery on the outer side. Okay, we have a diagram here. If you can see a diagram here. Yeah. So this is the anterior part. On your extreme right is your anterior part. And it separates the middle ear from internal carotid artery. Now, anterior wall has two holes, we can say, two windows, we can say. The first is the canal of tensor tympani, from which the tensor tympani muscles enter from that canal. And the second part is an opening of osteition tube. All right. So if you come on the left side of the page, you see an osteition tube. So this osteition tube is actually coming from the second part of the anterior wall. And that attic, if you can see the round attic, this is placed right in front of the medial wall here. Okay, so osteition tubes entered into the opening of the osteition tube, and the attic of the middle ear sits in the medial wall. All right, and then we have adductus. If you can see this part, the adductus, adductus is the ninth marker, if you can see here. So adductus extends into the posterior wall. The osteition tube enters through the second part. Attic sits in the between the medial wall, and the adductus enters into the ninth part. All right. This is just a brief diagram. So just remember that anterior wall is a thin plate of bone which separates internal carotid artery from the middle part. It has two openings. The lower one is for osteition tube, and the upper one is for tensor tympani muscle. All right. Coming to the posterior wall lies close to the mastoid cells. All right. It presents on the bony projection called pyramid. Let's go back to the diagram again. Okay. So here the eighth is the pyramid. And you can see the posterior wall here. So the eighth point is where the pyramid lies. So remember that posterior wall is close to mastoid ear cells. It is present by bony projections called pyramid. Okay. And we have adductus, of course. As I told you, the adductus will lie on the ninth part, with which the attic communicates with the antrum. And it is just above the pyramid. So just like this, ninth part is adductus, and adductus lies above the pyramid. Right? Ninth and eighth. And it communicates with mastoid ear cells. So the posterior wall communicates with the mastoid ear cells, and the anterior wall gives an opening to the osteition tube, and attic and the middle ear gets fixed in the middle part between anterior and posterior walls of the middle ear. I hope that's clear. Now, coming to the medial wall, it is behind. So you have anterior, posterior, and medial. So medial wall is formed by librinate. Okay, it has a round bulge in between called promontory. All right. So if we can move to the next diagram, this is how the medial wall of middle ear looks like. And the 11th marked here is the tympanic plexus, and that tympanic plexus is placed in the promontory. The promontory is a round circle. The number 1 marked is a round circle in which place is tympanic plexus. So all these 3 diagrams are important for your university exams. It's difficult to draw, but it is important to practice, because if you draw these diagrams before writing the theoretical part, just after presenting your introduction, if you draw these 3 diagrams, your theory will be easy, and the examiner will not even look at the theory part. He will just give you marks by looking at the diagrams. So make sure you know the diagrams. That's why I'm focusing more on the diagrammatic part. So you have a promontory, and in the promontory, we have tympanic plexus. And this is the medial wall of the middle ear. Okay. And now in the medial wall of the middle ear, if you can see the yellow coming down, it's the 7th cranial nerve. That's the facial nerve. All right. So above the facial nerve, you have a horizontal canal, the round one, the 5th one. And below it, the 4th one, you have an oval window. Coming to this point, here you can see the 4th point is oval window. All right. And the 6th one is a horizontal canal. The 7th one is 7th cranial nerve is here. So this is how the medial canal looks like. Anterior, posterior, medial. The medial has the facial nerve. All right. Above that, you have a horizontal canal. Below that, you have an oval window. And the 3rd one, we have the 4th one, we have a round window. All right. So we have an oval window. We have a horizontal canal. And the 6th, we have pyramid. But pyramid is attached to the posterior walls. All right. So you need to draw this diagram. Just remember that the medial wall of the middle ear has a horizontal canal, an oval window, which is very important. We have an cochlear formis. Number 2, cranial nerve is important to mention, promontory is important to mention, and tympanic plexus is important to mention. And there's one more thing, we have round window. Number 10. So we have an oval window, we have a round window, and we have a horizontal canal. 1 canal and 2 windows. Okay, remember this diagram? This diagram, oscillation tube enters into the anterior wall of the middle ear, and the atic places in between the middle ear, and mastoid process is behind the posterior wall. So the posterior wall is attached to the mastoid air cells. I hope this is clear. Okay. The medial wall is formed by librinate, presents with the bulge known as promontory, and promontory is due to the basal coil of cochlea. So actually the cochlea is placed in the medial wall. So that's why what happens is that it forms a promontory. It forms an impression. Then you have an oval window and a round window. All right. These 2 you have to remember. Now coming to the point, what happens above the oval window is a canal of facial nerve. All right. So facial nerve, the yellow marking that comes down, it is a bony covering. Sometimes it is congenitally dehiscent. So the nerve will not be lying in the canal. That's how it is more prone to infections in some people. All right. And the medial to pyramid is a deep recess known as sinus tympani. Let's go back to the diagram again. So here, 8th one is sinus tympani. Okay. So this is due to an impression. It forms a sinus tympani. Now, the lateral wall is formed largely by the tympanic membrane. Okay, the lateral wall. So lateral wall is formed by tympanic membrane, and to a lesser extent by bony outer actic called sputum. Okay, tympanic membrane is a window it forms a window to the middle ear. So it's an osciillation tube, tympanic membrane. Remember this. It is possible to some structures of middle ear through normal tympanic membrane. Example, we have a long process of incus, and we have a joint named as incudostupidal joint, and then we have a round window. These diagrams are important, very, very, very important for the exam. Let's have a brief look. Walls of middle ear and structures related to them. We have the anterior wall, we have a middle wall, medial wall, posterior wall, and a lateral wall. Right? Anterior wall has two windows. First is we have an opening of osciillation tube. Second, we have tensor tympani. All right. Then number two. Where is number two? Number three. Number three is oval window. Okay. And number four is round window. Number five is processus cochlear-formus. Number six is horizontal canal. All these are in the medial wall. And even the seventh one, the facial nerve, is in the medial part of the medial wall of the middle ear. Now coming to the posterior parts, we have pyramid, 9, 8, 9, pyramid and adductus. 10th, we have chorda tympani nerve. It enters from the posterior to the lateral part. From the posterior to the lateral part. So chorda tympani is a branch of facial nerve. You can see it very clearly. Remember, the floor of the middle ear separates it from the jugular bulb, and the anterior wall of the middle ear separates it from the internal carotid artery. These three diagrams are important again. Now we have one more question, a 4-marker. Physiology of equilibrium and vestibular system. So this means how important is an ear to maintain the balance of the human body. A useful clinical approach to understand the physiology of equilibrium is to imagine that the balance system. So what is the balance system that human beings are having in the ear? We have a vestibular, visual, and somatosensory. 3. Okay. So one, it is like a push and pull technique. So one side it will push and one side it will pull. Okay. So in static, we have a neutral position. So each side, pushing and pulling is equal. Now push and pull system of one side is equal to that of other. Your right hand, let's say, is pushing equally with the force of the left hand. But what happens if one side pulls more than the other, then you have a problem of equilibrium. So during the movement, that is turning or tilting your head, there is a small change in push and pull system. If you rotate your head continuously, after some time, if you stop, your head will take time to come into that neutral position. That is corrected by reflexes and motor outputs of the eyes. That is known as vestibulo-ocular reflex and vestibulo-cervical reflex. And another reflex known as vestibulo-spinal reflex. So imagine you move your head, you tilt your head for like 10 seconds and then you stop. After some time, it comes to a neutral position. That is because of 3 reflexes: vestibulo-ocular reflex, vestibulo-cervical reflex, and vestibulo-spinal reflex. That is to maintain the new position of the head and body. These are playing push and pull system from one side to another. Now, if this is not distributed properly for a longer time, you will have diseases like vertigo and ataxia. Okay, so remember 3 reflexes are important for the human's equilibrium system. Can be asked in Viva: vestibulo-ocular reflex, vestibulo-cervical reflex, and vestibulo-spinal reflex. Now we have something in a peripheral system which is made up of membranous labyrinth. This is known as semicircular canals. We have utricle and saccule. And we have a nerve known as vestibular nerve. And we have a central again. So we have peripheral, we have central. Central is made up of a nuclei and fibers. And we have central nervous system to integrate vestibular impulses. So these impulses will send messages to the central part and to the other parts of the body to maintain your balance. Okay. In exam, remember to mention the T reflexes: vestibulo-ocular reflex, vestibulo-cervical reflex, and vestibulo-spinal reflex. Now, third question for the day is tympanic membrane. What is tympanic membrane? Tympanic membrane is a partition between your external acoustic canals and your middle ear. Okay. So here in the diagram, again, for this question, you have to draw the diagrams. If you draw these two diagrams, you have marks in your pockets without writing theory, I'm telling you. So this diagram, you have pars flaccida, you have pars tensa, and you have annulus tympanicus. Okay. This is how the tympanic membrane actually looks like grossly. Here, you can see a coronal section through the tympanic membrane, an external ear canal that shows the structures of pars tensa, pars flaccida, and external canal. So on your left is your external canal. It means this is your left ear. And in between the line, that is the tympanic membrane. So it has pars flaccida, pars tensa, and it has annulus. This is your tympanic membrane. Okay. This is also one diagram which you can draw. You have a shadow of round window, pars tensa. You have a cone of light. You have annulus here. You have shadow of a joint. Stapedius and malleolus joint. This is how you can draw the diagram, any one diagram. So here, coming to a brief part, the parts of tympanic membrane, pars tensa. It forms most of the tympanic membrane. So the large part in between, like a drum, that's pars tensa. Its periphery is thick, okay, and it forms a fibrocartilaginous ring called annulus. So this big thing that you can see in between is pars tensa. Majority of the tympanic membrane is covered by pars tensa, and the outer layer is covered by a fibrocartilaginous rim called annulus. Okay. The central part of pars tensa is tented inwards. So it's like a paper that is pulled inside, like this, at the level of tip of malleolus, and is known as ombo. The bright cone of light can be seen that is radiating from the tip of malleolus to the periphery. So here, if you can see, from the tip of malleolus to the periphery, you can see a cone of light. Okay, this is also a part of pars tensa of middle ear. Now coming to the part of pars flaccida is also known as shrapnel's membrane. This is situated above the lateral process of malleolus. So going back to the diagram, pars flaccida is this one. Okay, it is the most upper part. Here it is this one. So pars flaccida is situated above the lateral process of malleolus, okay, between the notch of Rivinus and the anterior posterior malleolar folds. Okay, it is not so taut, it is not tightly attached to it. It is somewhat loose and it can appear pinkish. All right, that's all about pars flaccida. Remember to write the word shrapnel's membrane in the exams. You can get an extra tick of marks. Now we have another question that can be asked in exam. This is all about tympanic membrane. Coming to the next question that can be asked in exam is intratympanic muscles. This is the diagram that you should draw. But before I come to the diagram, you should know there are two muscles. One is tensor tympani and the other one is stapedius. Two muscles. Here you can see stapedius, right? And the other one is tensor tympani. Two muscles. The former, that is stapedius, is attached to the neck of malleolus. Here, you can see it is attached to the neck of malleolus. Stapedius is attached to the neck of malleolus, very clearly seen here. All right. And while the later attaches to the neck of stapes. So one is attached to the neck of malleolus and the one is attached to the neck of stapes. Okay. So what actually the muscles of muscle of tympanic, intratympanic muscles do? These muscles will help prevent extra noise entering into your ear. So they actually act as resonant, or they dampen a very loud sound. That leads to prevention of noise trauma to the inner ear. Okay. Stapedis is formed by second arch muscle and is supplied by branch of seventh cranial nerve. Okay. Stapedis is supplied by seventh cranial nerves branch, that is facial nerves branch, while tensor tympani develops from the first arch and is supplied by branch of mandibular nerve. So here there's a way to remember that stapedis is S. So it is derived from second arch, S. Okay. And it is supplied by a branch of seventh cranial nerve. Whereas the first arch is supplied by a branch of mandibular nerve. Now coming to the next question, we have anatomy of membranous labyrinth. Okay, this is the anatomy, very brief diagram. This is also, it's very important to draw the diagrams. You should draw the diagrams in exam in order to acquire marks, so that even if you miss something in theory, you will get marks from these diagrams. All right. So you have Crohn's commune here. You have a saccule. You have a very beautiful cochlear duct that looks like a snail. You have ductus reunions. You have an endolymphatic sac, and that endolymphatic sac opens into the endolymphatic duct. And all these opens in the crus communes. Cochlear duct, this one that we'll talk about. Beautiful like a snail. So cochlear duct is also known as membranous cochlea, or also known as scala media. It is a blind coil tube. It's like a tube. It's like a snail. It actually appears triangular on cross section. So if you do a cross section, it will look like a triangle. And it has three walls: a basilar membrane, a Resener's membrane, and stria vascularis. Okay, 1, 2, 3. BRS. Basilar membrane, Resener's membrane, and stria vascularis. Basilar membrane is which supports the organ of Corti. Okay. And Resener's membrane separates the scala from the vestibular. So this is only when you can see. Here you can see scala. Right? So the Resener's membrane separates it from scala. And stria vascularis, it contains a vascular epithelium, and it is important for secretion of endolymph. All right. It has three layers. When you do a cross section, it looks like a triangle. Now talking about cochlear duct is connected to scala by ductus reunions. Here you can see cochlear duct attached to scala by ductus reunions mentioned in red, bold. Okay. And the length of basilar membrane increases as we proceed from basal coil to apical coil. So the length increases as you move from the basilar coil to the apical coil. So it's like a triangle, right? So as closer you move to the apical coil, it becomes longer and longer and longer. It is for this reason that higher frequencies of sound are heard at basal coil. Remember this. High frequency sounds are heard at basal coil, and the lower ones are heard at the apical coil. Apex and base. Basal coil have higher frequency and apical coil has lower frequency. Talking about utricle and saccule, going back to the diagram again. Here you have utricle and saccule placed close to each other. Red is utricle and blue is saccule. So utricle lies in the posterior part of the bony vestibula. As you can see in the diagram, it is posteriorly. Okay. So the clinical anatomy of this is Meniere's disease. So if the saccule, it gets distended and lies against a stapes foot plate, It can be surgically decompressed by perforating the foot plate. Okay, so it perforates the foot plate. So that's how it causes Meniere's disease. And about Meniere's disease, we'll learn in upcoming classes where you will have a brief idea. But remember that Meniere's disease is related to utricle and saccule anatomy. So saccule lies in the bony vestibule. Okay, its sensory epithelium is also known as macula. Now we have something called semicircular ducts. There are 3 numbers and they are correspondent exactly to 3 bony canals. They open in the utricle, going back to the diagram again. These are semicircular canals, cruskimions. Okay, they open in the utricle. So they open in the utricle, and the ampullated end of each duct contains thick ridge of neuroepithelium called crista ampullaris. So every utricle, okay, it gets ampulated and becomes like a thick ridge of neuroepithelium, and that thick ridge is known as crista ampullaris. Like this, it becomes thick. All the points comes down together and it becomes crista ampullaris, formed by neuroepithelium. Okay. We have an endolymphatic duct and sac. Endolymphatic duct is formed by union of 2 ducts, one each from saccule and from utricle. Going back to the diagram again. This is endolymphatic duct formed by saccule and utricle. And it opens into the endolymphatic sac. Endolymphatic sac is surgically important because it's exposed for drainage or shunt operations in Meniere's disease. So when you have Meniere's disease, you will have to open up and you'll have to drain the fluid. So that's why it is important. Remember endolymphatic sac connected to the endolymphatic duct, and endolymphatic duct is connected to saccule and utricle. Here, you can draw this diagram also. You have Resner's membrane, scala tympani, basilar membrane, stria vascularis here. This is how the cochlea will look like. The round coiled cochlea. Okay. Now we have small questions like Eustachian tube. Eustachian tube extends from the bottom of concha to the tympanic membrane, and it measures 24 millimeter long. Depends on patient to patient, but approximately 24 millimeter long along its posterior wall. Remember, it's a straight tube and its outer part is upwards, backwards, medially. Upwards, backwards, medially. While the inner part of Eustachian tube is downwards, forwards, medially. So both of them comes medially. But one comes upwards and backwards, and the other one comes downwards and forwards. Opposites. The outer part comes upwards, backwards, and the inner part comes downwards, forwards. Both of them then meet medially. Okay. Therefore, to see the tympanic membrane, the pinna has to be pulled down and then upwards and backwards and laterally to bring that 2 parts in the alignment. Okay. So that's why you pull the pinna upwards and then backwards and laterally to get that alignment, and you get that beautiful view of the inner part of the ear. This is important again in the exam. Remember the direction of the 2 parts of Eustachian tube. Eustachian tube has an outer part, inner part. Outer part is directed upwards, backwards, medially. And inner part is directed downwards, forwards, medially. This is very important to mention in the exam. Now, the canal is divided into 2 parts, cartilaginous and bony. Okay, now cartilaginous part, 8 millimeter approximately. Okay, it has 2 deficiencies. Remember these 2. Fissures of Centuroni, number 1. Okay, in this part of cartilage, what happens is it passes through them the parotid or the superficial mastoid infections, and they can appear in the canal and vice versa. All right. And hair is only confined to the outer canal, and therefore furnicles are also present. So furnicles are more prone to staphylococcal infection. So these are clinical anatomies. All right. So you have a cartilaginous part, you have a bony part. Cartilaginous part is 8 millimeter approximately. Bony part is 16 millimeter approximately. Okay. It has two deficiencies. The fissures of Santeroni. In this part of cartilage, what happens? And through them, the parotid and the superficial mastoid infections can be seen, vice versa. Okay. Now remember, the skin covering the cartilaginous canal is thick and it contains pilosebaceous glands. Okay. These glands will secrete wax in your ear. Okay. So the skin over the cartilaginous canal is thick and it secretes pilosebaceous, it secretes wax from the pilosebaceous glands. So in exam, they can ask you, what secretes the wax in the ear? Remember, it's pilosebaceous gland. Okay. It is confined to the outer canal. Therefore, what happens? It is most prone to infections like staphylococcal infections, common in the in the cartilaginous part of yours. Coming to the bony part is 16 mm. Skin lines the bony canal and it is thin. Cartilaginous part is thick. Bony part is thin. Bony part covers over the tympanic membrane. Okay. It does not have hair or it does not have any form of gland. Foreign bodies log medial to isthmus gets impacted and therefore difficult to remove. So if your foreign bodies gets inside the bony canal, it becomes very impossible to remove that foreign body. Now, coming to the anatomical part, anterior inferior part of deep meatus presents a recess called an anterior recess. So you will have an anterior recess in the anterior front inferior part of deep meatus. You have an anterior recess. This recess acts as a pool for discharge of debris in cases of external and middle ear infections. So in cases of external and middle ear infections, you'll have discharge. That discharge is because of this recess known as anterior recess. And this anterior recess is placed in the anterior inferior part of the deep meatus. Okay. This can be present as a deficiency, also known as foramen of Hashki. These cannot be present in children up to age of 4 or sometimes in adults. This leads to permitting the infections and from there it will enter into the parotid gland. Okay. So remember, bony part has an anterior recess placed in the anterior inferior part of the deep meatus, and it plays an important role for discharge of debris in cases of external and middle ear infections. All right. Now we have the last thing, that is McEwen's triangles. Okay. McEwen triangle is actually a 2 marker and also an important point. It is behind your behind the outer part of the ear. So if you can feel you have a bony prominence behind your ear, that's your mastoid bone. Okay. And behind that mastoid bone, there's a hollow. That triangle is known as McEwen's triangle. So it is enough for you to draw this diagram in the exam, where you can see you have a spine of Henle. Okay. And you have an external auditory meatus and you have a mastoid tip. If you touch behind your ear, what you can feel is your mastoid tip. And above that, there's a triangle known as McEwen's triangle. Okay. So I think we're done with this. Thanks for watching. And I hope you like my class. Please follow up on YouTube, Instagram, Facebook, and Telegram for more. Thank you.